Performance management is a vital component of human resource management that ensures the effective use of resources, which at times can be scarce. It is a continuous process of identifying, measuring and developing the performance of individuals or teams and aligning that performance to the strategic goals of an organization. This is why the Ministry of Health has invested in refreshing health workers with this knowledge. Here in Kabale district, a total of 100 health workers attended a 5-day workshop where they received training on various topics under performance management and evaluation.
We realized over time that we are recruiting people, the numbers were improving, but the performance was not improving as such. So we came up with a deliberate intervention on improving health work performance.
They were taken through 3 main functions, which are classified as strategic, administrative and developmental.
We teach them or support them in terms of how they can plan for their work, which we call performance planning, with clear targets, indicators and outputs, so that they know what exactly they're supposed to deliver on. And then when they've done that, they do plans, and then they're able to monitor.
The strategic function links the workers' performance to the overall organizational strategy.
They have been taken through how to set the critical targets, the good targets, and I know that that one will definitely translate into good performance for the hospital. They are going to share it because we had line managers. The line managers are going to cascade this information downwards.
The medical director at Kabale Regional Referral Hospital, Dr. Sophie Namasopo, says administratively, performance management provides valuable information to help the managers make important decisions such as salary increments, promotions, recognition and rewards.
When they know that they are contributing something towards achieving the targets of the hospital, it actually motivates them.
The hospital has over 3,000 employees, and Dr. Namasopo says all of them have been subjected to at least one annual appraisal.
As a hospital, we developed an appraisal hierarchy. In this one, it's like assigning particular people to appraise. So it's good that from the start, actually somebody knows who the supervisor is. Because previously, we used to actually have for example, in the line of the nurses, would be only the PN auto appraise, or on the line of the doctors, it would be, say, the hospital directors. But now, as it is, usually it's just the immediate supervisor in your line that appraises you.
The developmental function of performance management is realized through the provision of information on the strengths and weaknesses of healthcare workers. Performance management involves 6 main steps, which include having knowledge of the job and organization mission, performance planning, performance execution, performance assessment and performance review, as well as performance renewal and recontracting. Mary Kamigisa, a senior clinical officer, and Miracle Tumuhimbise, a nursing officer at Kabale Regional Referral Hospital, say they have learnt a lot from the training.
If you cannot punish somebody or give somebody a punishment if you're not doing that thing, you will not be able to appraise that person so well. If you talk on the issue of coming on time or absenteeism, if you're doing it, you will not tell this person that you have a low mark because of this and this that you yourself are doing. So mainly you also have to be an example.
Appraisals help us to identify gaps as staffs where we need to improve so that we can deliver good health services and care to the patients.
I'm going to think to put there more meetings for us so that we talk about these issues more often.
Dr. Namasopo says through monitoring and evaluation, they have been able to reward and even sanction some poor performing staff at the hospital.
So when they have been nominated, the overall best, we always buy a present for the person. Then the others at the departmental level, we usually just give certificates of recognition. Then on the side of sanctions, we've actually, there are some people that have been sanctioned, though the ones that reached the level of leaving public service. It was concluded when I'm in office, but somehow it had been a long process. So it actually went up to the Health Service Commission.
However, she says some cadres are not considered in the rewards category, which leads to poor morale towards work.
Askaris, once you enter as Askari, you ate, that is it. So unless you go back to school and study something else. So even if you keep appraising, you will not get the next promotion. The others are drivers. Usually they keep complaining that there's no senior driver, so that is, I will not get any promotion. Yet, in this line, if I'm an enrolled nurse, I work well, I get a good appraisal, I can get promoted to a senior enrolled nurse.
This intervention by the Health Ministry is aimed at eliminating inadequate performance management, which could be one of the contributing factors to stagnation to some of the key health indicators in the ministry's strategic plans. Walter Mwesije, NTV, Kabale District.